Hey viewers and listeners, today we will discuss about depression. Basically, depression is major depressive disorder, a common and serious medical illness that negatively affects how you feel, the way you think and how you act. Fortunately, it's a treatable condition. Depression causes feelings of sadness or a loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at work and at home. Depression symptoms can vary from mild to severe and it can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, change in appetite, weight loss or gain unrelated to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity or slow movement or speech, feeling worthless or guilty, difficulty thinking, concentrating or making decisions, thoughts of death or suicide. Symptoms must last at least 2 weeks and must represent a change in your previous level of functioning for a diagnosis of depression. Also, medical conditions, for example, thyroid problems, a brain tumor, or vitamin deficiency, can mimic symptoms of depression, so it is important to rule out general medical causes. There are some risk factors for depression. Depression can affect anyone, even a person who appears to live in relatively ideal circumstances. Several factors can play a role in depression. Difference in certain chemicals in the brain may contribute to symptoms of depression. Depression can run in families. For example, if one identical twin has depression, the other has a 70% chance of having this illness sometime in life. Personality: people with low self-esteem, who are easily overwhelmed by stress, or who are generally pessimistic appear to be more likely to experience depression. Continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression. Depression is among the most treatable of mental disorders. Before a diagnosis or treatment, a health professional should conduct a thorough diagnostic evaluation, including an interview and a physical examination. In some cases, a blood test might be done to make sure the depression is not due to a medical condition like thyroid problem or a vitamin deficiency. Brain chemistry may contribute to an individual's depression and may factor into their treatment. For this reason, antidepressant might be prescribed to help modify one's brain chemistry. These medications are not sedatives, uppers, or tranquilizers. They are not habit-forming. Generally, antidepressant medications have no stimulating effect on people not experiencing depression. Antidepressants may produce some improvement within the first week or two of use, yet full benefit may not be seen for 2 to 3 months. If a patient feels little or no improvement after several weeks, her psychiatrist can alter the dose of medication or add or substitute another antidepressant. Psychotherapy or talk therapy is sometimes used alone for the treatment of mild depression. For moderate to severe depression, psychotherapy is often used along with antidepressant medications. Cognitive behavioral therapy has been found to be effective in treating depression. Electroconvulsive therapy is a medical treatment that has been most commonly reserved for patients with severe major depression who have not responded to other treatments. It involves a brief electrical stimulation of the brain while the patient is under anesthesia. A patient typically receives ECT 2 to 3 times a week for a total of 6 to 12 treatments. It is usually managed by a team of trained medical professionals, including a psychiatrist, an anesthesiologist, and a nurse or physician assistant. Please like and subscribe my channel and see you guys in the next video.